Okay, hi. Here we go with course number 8. And what I'm going to talk about today is there was a video that previously had been listed as one that we are using for this course. It was listed at number 7, and for some reason the video stopped working, and it was on an interesting topic. So I wanted to cover that topic tonight. So what we are going to be talking about tonight is physical illness in patients with severe mental illness, and part of where we're going with this is talking about not only the interaction of psychotropic medications with physical illness, but also on some of the ways that severe mental illness can impact on some of the ways medical illnesses are treated, looked at, addressed, and that sort of thing. So what we're going to be looking at tonight is the interaction of severe mental illness and medical illness. Like I said, it was a video that previously had been listed for use in this course, but stopped. The video was no longer working, was no longer available for public use. So I decided to address the topic here in the recorded lecture. It is interesting to keep in mind that one of the facts that connects up with this issue is that the lifespan of individuals who have severe mental illness is significantly shorter on average than for those individuals who do not have severe mental illness. And that's an important thing to keep in mind, that there really is a major impact of severe mental illness on medical health. And as we will see in this course, there are a number of different factors that go along with that. But those factors largely fall into two major groups. One is the impact of psychotropic medications on physical health. There are a lot of physical diseases that are impacted directly as a side effect of medical treatments, or as an interaction, side effect of psychotropic medications, or a side effect of the physiological factors leading to the illness. And then the other category of factors that influence the lower life expectancy of individuals with severe mental illness is the impact of mental illness on how the person takes care of themselves, how they utilize services and whether they utilize services, and that sort of thing. By the way, when we talk about severe mental illness, really there are 3 categories of diagnoses that are typically associated with severe mental illness as a category: schizophrenia, bipolar disorder, and major depressive disorder. Those are the 3 main categories. And some of the factors that can impact medical disease that are associated with severe mental illness. So our nutritional and metabolic disease, cardiovascular disease, viral diseases. And it's interesting now to keep in mind the impact of COVID on severe mental illness, how there's interaction there. Musculoskeletal diseases, sexual dysfunction, pregnancy complication, and obesity-related diseases. So those are some of the types of diseases that can be directly impacted by severe mental illness. And I'm going to cover, and there are others, and I'm going to cover some of the specific medical issues that can be impacted by severe mental illness. I'm going to discuss some of them in more detail. So the factors I just outlined are just some of the factors, some of the medical factors that can be influenced by severe mental illness. And I'm going to talk in detail about a few of those medical factors. The first thing that I'm going to talk about is obesity. Obesity tends to be a medical issue that tends to be largely correlated with severe mental illness. As much as 72% of patients who are on some sort of psychotropic medication for severe mental illness have obesity. And again, severe mental illness, schizophrenia, bipolar disorder, and major depressive disorder. So some studies have found that as high as 72% of individuals who take psychotropic medications for severe mental illness have some form of obesity. And there are two, again, going with those two categories of major issues that are often associated with problems, medical problems with severe mental illness. There are some direct relationships of medications having a direct impact on people gaining weight. We talked earlier in the course about some of the ADHD medications are well known for leading to individuals, particularly children and teenagers who are on that medication, gaining weight. Weight gain is a big problematic side effect associated with ADHD medication. So the weight gain can be a side effect of medications. Two medications that have the highest degree of weight gain problems associated with them are both antipsychotics, clozapine and olanzapine. And olanzapine is the generic form of Zyprexa. And in fact, I'm going to talk about Zyprexa in a little bit more detail here in a minute, because Zyprexa is, interestingly enough, associated with a number of medical issues. There are a number of medical issues that are specifically highly correlated with the use of Zyprexa. But clozapine, if you remember, last course when we talked about antipsychotics, we talked about how clozapine is a medication. It's an atypical antipsychotic that often has been seen as one of the more effective antipsychotics. In fact, it's the antipsychotic that sort of is considered the last line of treatment. So when you've got treatment-resistant psychosis, very often clozapine is sort of the last one people will use, because it is considered to be very effective in forms of psychosis where other antipsychotics are not being effective. The problem with it, this is a good example of the problem with clozapine is it has a lot of side effects associated with it. There were a lot of medical issues that can be strongly associated with the use of clozapine, like weight gain, and as we'll see later, diabetes, other medical issues are strongly associated with the use of clozapine. So there's a real potential difficulty there with the use of that medication. Like I said, another one that has a lot of these medical side effects associated with it is Zyprexa. And in fact, I'll talk a little bit more specifically about Zyprexa in a minute. Now, some of the other non-side effect factors that can associate with the high level of obesity in individuals with severe mental illness lack of exercise, poor diet. Individuals with severe mental illness often do not follow through consistently on things like exercise or following a good diet. It is one factor that you will hear where that is relevant in a number of these situations to keep in mind about severe mental illness is many individuals with severe mental illness, I would say probably the majority, although I don't have the numbers on that, but a large percentage, if not the majority of individuals who have severe mental illness also have low incomes. Many people on schizophrenia are on some form of disability. Many people with major depressive disorder and bipolar disorder are not able to keep a job, or at least maybe not able to keep a job where there is a lot of responsibilities. So so those are some non-side effects factors that are associated with increased weight gain, lack of exercise, poor diet. All those sorts of factors enter into individuals having problems with obesity, and obesity is associated with a lot of other medical problems. So obesity is often associated with a lot of medical issues, and obesity is very high in individuals who have severe mental illness, and particularly individuals with severe mental illness who are on psychotropic medications. Another medical issue that is quite high among individuals who have severe mental illness is diabetes. Obesity plays a major factor in developing diabetes, and as we just said, individuals with severe mental illness have a high rate of obesity. So there also are a lot of side effects. Diabetes can be the side effect of certain medication. And in fact, one thing I wanted to do here is I wanted to share briefly some slides that I have on Zyprexa. Because Zyprexa is associated with is associated with diabetes as well. Now, notice this. One thing, a couple things I wanted you to keep in mind here. Zyprexa is structurally similar to clozapine. So notice that there is something in the way that Zyprexa and clozapine are made, that they have a higher rate of obesity, a higher rate of diabetes. So these are two medications I wanted you to just be aware of. Although they are considered to be very effective for treating psychosis, treating schizophrenia, they also have a lot of medical side effects to that. And in fact, these two, Zyprexa and clozapine, probably have the most medical side effects. And notice how they are both in the category of Zyprexa here and clozapine here, of atypical antipsychotic drugs. And as a group, atypical antipsychotic drugs have a much higher rate of medical side effects than the typical antipsychotic drugs. So when we talked previously about how atypical antipsychotic drugs are being used more often due to their being effective, it may be surprising that they are not being used at a much higher rate than they are being used. It is interesting to consider that typical antipsychotics still are used more often than atypical antipsychotics, but the rate, the difference is decreasing. Atypical antipsychotics are being used more often, but one of the reasons that atypical antipsychotics haven't been used more, and why typical antipsychotics are still there, even though generally atypical antipsychotics as a group have been found to be more effective, is because of this relationship to severe medical problems, like diabetes, like obesity, some others that we'll talk about, cardiovascular disease, COPD, are all associated with these. So it's fascinating. And I wanted to take a look at just, by the way, here, serotonin, dopamine antagonists is the category of this. I don't really, I'm not going to go into detail about what this means. But what is interesting about this is notice that, again, you have how these medications are changing the level of serotonin and dopamine. And the more severely you change these levels, and in fact, it's interesting to consider that not only are these medications changing the levels of these two neurotransmitters. One of the reasons why I didn't want to get into much discussion about what serotonin dopamine antagonist means is because it's very chemistry oriented. It actually changes how these two neurochemicals, how the neurotransmitters act. It actually talks about, it actually addresses how they combine to other neurotransmitters. And so you're not only just increasing or decreasing the amount of these neurochemicals in the body, you are actually changing the very nature of how they interact with each other. And remember why this is all relevant is remember what we talked about, particularly with serotonin, is that it's not just involved with psychiatric function or psychiatric disorders. It's not just involved in the category of abilities that we would call psychological functioning. It's associated with stomach and heart functioning. It's associated with neuromuscular function. So these neurochemicals are elsewhere in the body and they affect other parts of the body. And that's why you have things like diabetes, obesity, COPD, heart problems, all of those also being impacted by the use of these medications because they do impact other parts of the body. And the atypical psychotics have more medical issues associated with them. So notice here, what the typical psychotics do is